Hello everyone, this is Dr. Unfortunately, we are now facing third wave of pandemic. Hope everyone be safe and healthy. As explained in the previous lecture number 10, the major difference between socket preservation and ridge augmentation is the place to be repaired based on the cortical bone expressed in red dot line. In other words, socket preservation is implantation for interior skeletal cortical envelope. Ridge augmentation is implantation for exterior skeletal cortical envelope of red dot line. Today's presentation shall be application of moldable AutoBT dentin powder, which can be molded to fit into the shape of the defect in ridge augmentation procedure, and the 3-year follow-up progress will be presented as well. As aesthetic zone of upper anterior teeth, ridge augmentation is necessary to repair the destroyed labial wall for covering up the 5 to 6 mm exposed implant surface. Moldable type of AutoBT dentin powder having osteoinductive and osteoconductive capabilities is indicated for this case. Because moldable AutoBT can be molded into the defect area with the desired volume and shape. Also, the patient's own blood will be observed into it to maintain its volume and shape. It can perform the desired functions without using barrier membrane. Let's see the application. Because the surgical area is the anterior aesthetic zone, clavicular incision was applied to preserve gingival textures. After the extraction, removal of the inflamed gingival tissues and bone with bar trimming. As usual procedure, verifying the 5 to 6 mm labial wall defect due to the resorption along with the implant of the palatal walls. Molding the AutoBT dentin powder in round and ball shape. Transfer it to the defect. Put it with pushing light finger pressure over to fit to the defect. As the patient's own blood soaked into the dentin powder, it does not move or drool. You can see the applied dentin powder soaked with the blood with being replaced the defect part. This is the good reason why the barrier membrane is not necessary using this moldable dentin powder. 3 years later, photos the labial cortical bone were well created, so the border of defect over the labial side of the implant fixture were completely disappeared. The volume and quality of the cortical and cancerous bone complex are well structured as well. If you see the right-hand enlarged photos, you will see the slight difference in color between the regenerated cancerous bone after ridge augmentation and the former cancerous bone in cortical bone. In other words, the regenerated cancerous bone is still on the remodeling transition process to normal cancerous bone with the function of the dental implant. Hence, the estimated prior skeletal envelope is on this point. However, the remodeling process is beyond this point to develop skeletal envelope, new skeletal envelope like this. This labial bone area is newly regenerated alveolar bone with ridge augmentation accomplishment, and this shows the normal cortico-cancerous bone complex as its regeneration and preservation by this moldable AutoBT dentin powder. Here is the summary of today's presentation. First, AutoBT has characteristics of osteoinductive and osteoconductive capabilities. Second, moldable type AutoBT is the solution to fulfill the volume and shape of the defect. Also, its use does not need to consider of using membrane due to inherent membrane replacement function. Third, this moldable AutoBT dentin powder has remodeling capabilities as its function of alveolar bone regeneration and preservation over the long-term clinical result. Thanks for your kind attention. This has been Dr.